So no, that's actually a myth. So the flu shot doesn't contain live virus. So you can't get the flu from the flu shot.
Okay, so we're just going to ask you a couple of questions just around the flu vaccine and just to give some people some other perspectives around it as well.
For sure. All
All
right.
right, so I'll jump into the first question. So, is it true that the flu vaccine can give your child the actual flu?
So no, that's actually a myth. So the flu shot doesn't contain live virus. So you can't get the flu from the flu shot. It trains your body to recognize the flu virus, but it doesn't give you the flu. You can experience maybe like some soreness in your arm, or you can get some mild fatigue, and that's basically just like your immune system doing its job, just building up the antibodies to make to defend against the flu virus. So no, that's a myth.
Okay, thank you. Thank you for that. So, just to piggyback off of that, I know some parents say that the flu shot doesn't work because their kids have gotten the flu
Yeah.
after being vaccinated. So, does that mean that it's ineffective in any way?
Yeah, so that's a good question, and I totally understand that. But the flu shot isn't 100% guaranteed, right? So you can get the flu even if you had the flu vaccine. However, the flu vaccine does still give you protection. So if your child does get the flu, they're going to experience milder symptoms. They'll be able to recover much quicker. So it'll just be able to get back to school sooner, and end up with less complications overall. So overall, it's still good that they got the vaccine, um, and it just protects them from complications.
Okay, okay. I think we both have experience with our kids getting the flu shot that they don't stay sick as long when they do
Right.
get sick.
Exactly.
So,
Yeah.
okay. And I've heard that the natural and herd immunity is better than vaccine protection. Is that something parents should rely on?
So I would say no. So, natural immunity means you build immunity by getting the flu, and that can be risky, right? So, like we just talked about, so the flu vaccine can have complications. So you can get really high fevers, you can get pneumonias, it can lead to hospitalizations. So you don't want to risk that. The herd immunity that happens when there's a large vaccination rate in your community. So really, the safest way is to build your child's defenses to the flu is by getting the flu vaccine. That's the safest, most effective way.
Okay.
Yeah.
All right. I just have two more questions.
Yeah.
Okay. And are there any long-term side effects for giving my child the flu vaccine every year? And should I be concerned about the thimerosal mercury in the vaccine?
Um, yeah, so I would say we should get the flu vaccine every year because the flu changes every season, and that's why there is a flu vaccine that comes out every year. And it is safe to get the flu vaccine annually. There have been many studies that have been done, and there have been no evidence of any long-term side effects of getting the flu vaccine annually. The thimerosal, there are trace very limited amounts of that in the vaccines, and most of the vaccines that are out right now, that are recommended for kids to get are preservative free, meaning they don't have any of the mercury in them. So you can also, ask your pediatrician about that as well.
Okay. All right. And my last question. So I've read that the flu vaccine rates can be lower in certain racial and ethnic communities. What are the main reasons for this, and what's being done to improve the trust and access for those vaccines?
Yeah, so that's a good question, important question. I think honestly, it has to do a lot with trust. I think a lot of families and these communities, just like historically have been, dismissed or mistreated in the healthcare system, and it takes a lot to kind of rebuild that trust. And so I think also adding on sometimes like the limited access to get to these offices or to get to clinics can also lead to the decreased rates of the flu vaccine. And a lot of the confusion online of just like misinformation and, this person saying this and what's actually true, right? So I think really the most important thing is to have open conversations with your pediatrician, with your provider, people that you trust, not showing any judgment, just showing up with like compassion and having really like building that trust over again, I think is going to be super important, and not like an overnight thing that happens, but something that we have to continue to work on. But I would encourage, all the parents out there to make sure that they bring up any concerns or any questions that they have about the vaccine to their pediatrician, because they're there to support you, not to judge you, and to really answer any questions that you have.
Okay.
And thank you so much for answering those questions. What I wanted to do is, because we jumped in with those hot hitting questions, because we know that's what everyone has top of mind. What I'm a little bit interested is telling us, if you could tell us a little bit about yourself and maybe like where your passion for this came from.
Yeah, so I just opened up my own pediatric practice called Empowering
Congratulations.
Pediatric Wellness. Yeah. And I started my practice because I just felt like I wanted things to be done a little bit different. I wanted to build relationships with families. I wanted more trust in communication and things. And the flu is, something that I am also passionate about. I mean, vaccines are effective and beneficial, and I think a lot of parents are confused, and I understandably, just with all the information out there. And I think that sometimes in going to the pediatrician, it can feel really rushed, and sometimes you don't have enough time to talk to your pediatrician about it. And I think it's really important to have conversations with parents and make them feel heard and seen and appreciated. And we're here for them, and we're trying to support them in every way, and their child.
I love that. Thank you so much. And we
Yeah.
do just have a couple of minutes, because I did see just a couple of questions come in. I think the question that I did just see is, if some children, are some children, do they pose a greater risk than others?
So to get the flu, I'm assuming is the question.
Yeah.
So the children that have like underlying illnesses are more at risk. So if they have asthma or any other type of underlying condition, they're at higher risk of flu complications, I would say. Children that are not able to get vaccinated because they're too young are at risk. So that's 6 months and under. And yeah, but even, healthy kids that have never been sick are also like can end up in the hospital with the flu. So it's really important to get all children vaccinated.
Okay. Absolutely. I don't think I want to give anyone a chance to ask any more questions.
And is this around about the good time to start getting vaccinated?
Yeah, so this is a really good time. So I would say like late September into October is a really good time to get the flu vaccine, because
Okay.
it takes about 2 weeks to build up your immunity. So then that way you're fully protected and covered and lasts the whole season.
Okay.
Okay, perfect.
Okay.
Okay, I think those were all the questions that I saw. We're very passionate about the topic. I think we've been talking about this for a couple of years now, especially with our girls. 7 and 4. We'll have a 5-year-old soon.
Crazy.
Oh, nice. My son's almost 5 too.
Okay, happy early birthdays to our little baby. Yes. So so it's very busy. It's a hot topic, especially in our household with our kids now. So we appreciate you coming in and talking with us and talking with our community. Just as you said, there's a lot of miscommunication and a lot of miseducation. So having someone like you come and talk to us and answer our questions, it's really important to us.
Awesome. Well, thank you so much for having me. This was great.
This
That's
is great.
great.
I want to let you guys know this live will be saved on our feed and also Vindico's feed on Instagram and YouTube. And thank you again, Dr. Andre, for joining us.
We
Thanks
appreciate
so
you doing
much.
Thank
Thanks.
you.
Right.
Have a good one.
You too. Bye.
But this session was developed by Vindico Medical Education with educational grant support from Seqirus USA Inc.